Hello and welcome again to UCL Global Health. Europe has faced the biggest financial problems of the last century in the last 5 years, and austerity economics has led to massive increases in unemployment in Greece and Spain. The figures are above 25%, which is higher than during the Depression in America in the 1930s. I'm joined by Professor of European Public Health from the London School of Hygiene and Tropical Medicine, Martin McKee. Just how bad is the situation from the point of view of unemployment, and what effects does that have on health?
Well, the situation is very bad. You mentioned the figure of 25% unemployment overall. Of course, we should remember that in some countries like Spain and Greece, youth unemployment is now 50 or 60%. That's problematic, obviously, for those people who are unemployed at the present time. But it's also difficult because we know that this is likely to be a lost generation. If you haven't had experience of working in your late teens, early 20s, your prospects in the rest of your life are going to be damaged as a result of that. The impact on health is very clear. We've done quite a lot of work looking at previous recessions, going back to the Great Depression of the 1930s. And what we see consistently is a rise in suicides, although to some extent this is counterbalanced by a reduction in road traffic deaths because people are driving less. But the suicides do go up, and we saw that in Spain in the 1980s, in the Scandinavian countries in the 1980s as well. And we're seeing that in Europe now. There's been a long-term decline in suicide rates that in virtually every country is now reversing.
What happens to alcohol and tobacco? Is the stress that leads you to want to drink and smoke more counterbalanced by the fact that presumably you can afford to buy less of it?
The situation is complicated with alcohol. What we've seen in two studies that we have done in the United Kingdom and with the United States data are that overall consumption does fall, but among those people who are problem drinkers, their situation gets worse. They do drink more. Binge drinking increases, but against an overall reduction in consumption.
What can we do? I mean, presumably you're in the non-austerity camp when it comes to economics, and you think presumably that governments trying to just solve this through the marketplace doesn't work, and that we need some kind of massive injection and stimulus rather than just cutting back on everything.
Well, I think we've seen a 5-year experiment in Europe, an experiment in which governments implemented austerity policies, and we now see very clearly the consequences, and that is of continuing downward economic growth. Only yesterday we saw that growth in the Eurozone had fallen by 0.6%, where we can debate whether we're technically in a triple dip recession in the United Kingdom, but certainly we've had no growth whatsoever for the last few years. So on economic terms, the policies are clearly not working. If we turn to health, then we can look at the experience of previous recessions. We showed in a paper in The Lancet that investment in active labour market programmes and social welfare that gets people back to work, retraining, giving them some hope for the future, at a level of expenditure of only about $200 per capita per year, can completely abolish the link between rising unemployment and suicides, as we saw in Sweden, a country with a well-developed welfare state, in the 1980s. But I think we also can look at the new work that has come out from the International Monetary Fund. Olivier Blanchard, the chief economist, has recalculated what's called the fiscal multiplier. Now, in the past, governments believed that spending their own money would crowd out private investment, would crowd out and would reduce the increase in employment. What we now know from the recalculation of the data that is completely wrong. The fiscal multiplier is not less than 1. In other words, $1 led to less than $1 of growth, but in fact is more than 1. And that means that investment in our forthcoming work, looking at investment in health and education, would actually have a positive impact on growth. And that's entirely consistent with the historical experience.
So you're in the Keynesian camp. We've got to spend more. We've got to stimulate our economy. We've got to have public government demand creation if we haven't got private demand. But what about regulation? What about the stereotype of the European bureaucrat? Everything's too regulated. There's not enough free market or labour freedom. Isn't this a problem? Isn't this part of the reason that Europe is not growing and that we're running into all these economic problems? How would you answer that?
Well, it's certainly represented in that way, but of course, remember that for a free market, we need to have goods that can be freely tradable. Now, we do have lots of regulations that on paper would seem particularly strange, like the definition of a banana or something like that. But by setting the limits for what a grade 1 banana will look like across Europe, that means that then every decision to import or export bananas does not need to go through that process yet again. So the bureaucracy that would be involved if you took away those regulations would be absolutely enormous.
Right. So the welfare system of Europe is often held up as something which is really powerful and important for public health. And I think the figures do speak for themselves that by and large, European public health indicators have been better than, for example, in many parts of North America. But there is a difference there that philanthropy and private investment in health in North America is massive compared to Europe. Do you see that as an issue?
Well, philanthropy in the United States, of course, has moved into where the state has failed to act.
Yeah.
The difficulty, of course, with philanthropy is that the decisions then on where to invest are made by the philanthropists. And unfortunately, the less attractive causes will often have less resources as a result. Government has a responsibility to look across the entire spectrum of society. Philanthropists can pick and choose, and unfortunately that means that we have many particularly vulnerable groups in the United States who simply fall through the safety nets.
Yeah, Mary Wollstonecraft used to say that the poor need justice, not charities. So
I think that's absolutely correct. You're simply plugging. The philanthropists are simply deciding where to put the money. Now, some, of course, like George Soros, is putting his money to the benefit of some of the most vulnerable people in society, but that's not the case for everyone.
final question. You're very close to European public health and policy. Do you think we're giving health the priority we should in Europe, or do you think it's often seen as a bit of a sideline and less important?
It is remarkable. In the Treaty of Maastricht and subsequently treaties of Nice and Amsterdam, public health was put firmly into the remit of the European institutions. The European Commission has a treaty obligation to evaluate the health impact of all of the European Union's policies. And here we are at a time of austerity whenever the European Commission, European Central Bank and the International Monetary Fund are imposing the most severe conditions on the welfare states in Southern Europe. Where is the European Union in assessing the health impact of those policies? It is completely absent. Its voice is not being heard at all. And yet the European Union should be championing the fate of the poor in Spain, in Portugal, in Greece.
Do you worry about corporate corruption in public health in Europe? Do you think it's there as it is in other parts of the world?
Unfortunately, we've recently seen quite a lot of evidence of that, particularly the role of the tobacco industry in undermining developments at a European level. The tobacco industry has been very effective in lobbying. Within the European Union, we have to remember that there are different directorate generals, one responsible for health, others responsible for international trade and the internal market and so on. And we've tended to see those focused on the internal market, on trade, triumphing over the interests of health. We have got very good evidence of how, in particular, the tobacco lobby, but also we have evidence of the alcohol lobby and the food lobby as well, playing a role there. Yes, I think we need to have much more transparency at a European level, as we do at the level of member states.
So medicine is about politics. Martin, thank you very much.
Thank you very much.